Palmetto Connections is a nonprofit telehealth network that services rural and underserved communities all across South Carolina. Our main focus and our main purpose is to make sure that quality healthcare services are infused into rural and underserved communities. We do not believe that your zip code should define the quality of life that you live or the type of service or the quality of service that you can receive. Living in a rural community is a lot different than living in an urban area. And it is great feeling to live in a small community where you know your neighbors. And so it's a great place to raise a family. There are lots of outdoor activities, lots of sports activities. You really learn what a sense of community is all about.
It can be difficult for many of our patients being in a rural community to leave the community. We're at least 20 minutes to Orangeburg and about an hour to any other major referral area. So if patients have to go to Charleston or Columbia, it can be very time consuming for them. It can be very costly.
It is very difficult to recruit providers to rural areas, let alone specialty providers. So instead of bringing the providers to our rural communities, the thought is that we bring the services from the providers to our communities. So even if your providers live in larger areas, you can still infuse those services into these rural communities. Bringing those services to those communities is what PCC is all about. Telehealth was never meant to take the place of in-person care. Telehealth is meant to complement that in-person care. If you need a follow-up visit and you can't drive 2 hours to Charleston and your visit's only going to take 10 minutes, you could actually do a really easy follow-up visit via telehealth to your specialty provider. So I think it is incumbent upon us to make sure that telehealth is part of today and it's part of the future, as I do believe it really is going to be the future of healthcare.
Really what they do is advocate and support telehealth being used in rural areas. And two, they focus on making sure that the infrastructure, largely broadband, but not exclusively, sometimes with technologies, endpoint technologies, are present in rural areas.
One of the ways Palmetto Connections promotes telehealth technology and broadband is by offering educational opportunities to healthcare providers across the state of South Carolina. PCC is the host of the annual Telehealth Summit, Telehealth Regional Symposiums, and Webinar Wednesdays. The annual Telehealth Summit started out as a one-day event with about 150 attendees and has grown to a 3-day event with more than 300 attendees. PCC also has an inventory of telehealth services in South Carolina displayed on its website as an interactive map. You can look through this inventory by the location, the type of service, and the provider of the service. Palmetto Connections partners with many organizations and leaders across the state to provide updates on telehealth reimbursement, telehealth policy, and best practices in telehealth. Telehealth is more than a tool that is being used during the COVID-19 pandemic. It is a part of the solution to improve access to care in rural and underserved communities.
What they bring to the table is a constant focus on the rural and underserved areas. And they do that from infrastructure and from assisting with education and consultations. Most of what they do besides the broadband aspect does occur in other domains as well. But what they really bring to the table always is a heavy focus on serving the underserved.
Over the last 10 years, I think that PCC has been a great advocate for rural communities. As the state has made substantial resources available for telehealth, PCC has been that consistent voice at the table, ensuring that rural providers and rural communities get the resources they need, and working with our statewide partners to see where need is, to look at opportunities that can be taken advantage of in rural, and to ensure that rural providers have what they need.
Palmetto Connections is South Carolina's broadband consortium. We file for over 100 organizations in the state of South Carolina, healthcare organizations. Since 2013, we've saved a little over $17 million for those healthcare organizations in South Carolina.
PCC did not start out working in the broadband area. As we were trying to expand telehealth across the state into these rural communities, we found that one of our largest barriers is actually broadband. And you cannot have a good telehealth visit or a good telehealth picture if you do not have adequate broadband.
In 2019, PCC, South Carolina Office of Rural Health, and South Carolina Hospital Association partnered to commission a comprehensive evaluation of residential broadband capabilities throughout our state. As healthcare organizations, the goal was to determine the gaps in internet access as a first step to making improvements which could impact healthcare, especially telehealth. Detailed maps were produced which depict the availability and speed of broadband access in each of South Carolina's 46 counties.
I really think that we're cutting edge as far as in what we provide to our patients. And I'm always proud of everything that we've been able to accomplish in a small town. I credit the resources and the connections that I've been able to make over the years. And many of those through Kathy, through PCC. So they're always there.
The presence and the name of Palmetto Care Connections has grown and is a staple of the telehealth discussions all across the state. So it's really grown, I won't say further than I thought it would. I guess I never really knew how much need and gap needs to be filled, and Palmetto Care Connections has really done that.
So I have a really great PCC team. The really cool thing about our team is everybody has lived or either grown up in a rural community. So they really understand what it means to live and work and receive health care in a rural community, so they can really speak the language and talk the talk when we're out there trying to advocate for telehealth in these areas. A lot of the future of Palmetto Care Connections is going to focus on broadband accessibility and affordability. We really have great plans to roll out a digital literacy campaign, starting out in some of our rural areas around our office location, but expanding into a statewide effort. One of the things that we've told leaders in the state is it's great if we can expand broadband, but we need to make sure that those homes have a device that they can actually use the broadband for, so that they can do quality education from home, or they can receive their health care from services from their couch. So a lot of our future is going to be about broadband, but we're also doing really unique, interesting programs such as placing telehealth services and equipment in rural independent pharmacies across the state. And it's going to be about telehealth expansion, but really focusing on a lot of these virtual access centers. So I think that's going to be a large part of our future.
For more information and education updates from PCC, find us on Facebook, Twitter, and LinkedIn.